Now?
Yeah,
Okay.
so let's talk about Dr. Art's these questions. So let's start with our first question. This is from Carly. And Carly says, my husband's lower leg, ankle, and left foot are swollen. The right foot is fine. He hasn't twisted it or it's fallen down. It isn't very painful. Is this something serious, or can it wait until next week when we see his doctor?
Well, what I usually suggest, first of all, when you have swelling in your legs, and a lot of people do have that swelling in their legs, from time to time, it could be something like congestive heart failure if it occurs in both legs. When it occurs in one leg, then I get a little more concerned because it could be what we call a deep vein thrombosis or a clot in the leg, and that could potentially even go to the lungs. So first off, I don't think you should wait. What I often suggest is that people see their doctor. If they can't get into their doctor, then they need to go to the emergency room, particularly if there's no history of trauma with the legs. So go to the emergency room. If you can't see your doctor, get what's called an ultrasound. They can do that ultrasound to find out if there's a clot in the leg, or even have a CAT scan of the chest to make sure it's not a pulmonary embolus. This can be a very serious condition. It needs to be treated sooner than later.
Okay, our next question comes from Denise. Denise says, I'm 65 years old and I have a burning sensation in my throat for the past week and difficulty swallowing. My husband thinks I have allergies and I should see an allergist. What could it be? And she's in Scottsdale.
Yeah, when you have any type of problem with swallowing in the throat, I think you ought to see a gastroenterologist. I don't think the allergist is the first stop. So see the gastroenterologist. They may want to do what they call an endoscopy. They may want to do what's called a barium swallow to see if everything's going down from the esophagus to the stomach okay. And I think this is something that can be more serious than simply some allergies. Although allergies can cause problems like that, it needs to be further evaluated again. A gastroenterologist should be your first stop.
Okay, David from Phoenix asks, I'm 56 years old. I'm a type 1 diabetic. My blood sugars are controlled, but I'm having pain and numbness in my feet every day. My doctors have told me it's a neuropathy due to damage in the nerves of my feet. I've heard vitamin B12 shots can help. What do you think?
Yeah. Well, vitamin B12 is certainly beneficial with people who have neuropathies. If you have diabetes and you've had it for a long-standing time, then you perhaps may have some neuropathy that's going down into your feet where it's damaging the nerves. B12 is certainly a beneficial treatment, but you ought to have a simple blood test. The blood test will determine whether you're B12 deficient or if you're folic acid deficient. So those are the first stop. Go to the doctor, get that test, and if you want to take some B12 over the counter, you can take 1,000 micrograms a day. That's certainly not going to be harmful. As you get older, the mucosa in your stomach thins a little bit, so you have a potential to have a vitamin B12 deficiency. So you can try that, but there may be other causes for the neuropathy in your feet besides the diabetes.
Jim from Scottsdale says he's had a headache for the past week in the front of his head and asks how he can tell if this is a migraine or a sinus headache.
Well, migraines usually come on with an aura. There's flashing lights, there may be a blind spot in the eye, you may even have a little bit of numbness and tingling. They're usually on one side. With a sinus infection, it's going to be a deep throbbing pain. It's going to affect your eyes, your cheeks, your gums, the front of your head. So all of those things are going to be affected. What I think you ought to do is just lean forward. If you lean forward and that seems to exacerbate the pain, then it's probably more of a sinus infection as opposed to a migraine infection. And it is something that can be evaluated by simply having a CAT scan of your sinuses.
That's really interesting.
Yeah.
So lean forward.
Lean forward. You lean forward, and if that deep throbbing pain seems to be throbbing a little bit worse, then it's probably more likely a sinus infection than a migraine.
Okay.
Yeah.
Great tip
Okay.
there. Also, Lucy writes, and I'm 66 years old. I have a high blood pressure. I'm taking 3 different medications to control it, but it's still high. Do you have any dietary suggestions?
Well, when you're taking 3 medications to control your blood pressure, it suggests that, again, you need to lose some weight probably. That will help to lower it. From the dietary standpoint, most people consume more sodium than they need. The average person consumes about 5,000 milligrams of sodium a day. I usually suggest 1,500 milligrams of sodium. That's a recommendation from the American Heart Association. So if you can reduce the salt in your diet, and it's not just a salt shaker, because there's copious amounts of salt in a lot of the foods that you're eating. The other thing is increase your potassium. That means eating more bananas, You can eat tomatoes. They are higher in potassium as well. And even sweet potatoes are high in potassium. So increase your potassium. Don't take potassium supplements over the counter, however, but there's a fine balance between sodium and potassium because that will determine how much fluid is retained by the body through your kidneys. So reduce the sodium and increase the potassium. At the end of the day, that may help blood pressure more than anything else.
Thanks, Doc.
Okay, you're
If
welcome.
you have a health question for Dr. Art, you can email him as well, askdrartmollen@gmail.com. We'll be right back.